Today, the world faces more uncertainty as the COVID-19 crisis drags on. While physical health is indeed a concern, it has also taken its toll on mental health. How can we look after ourselves even during this pandemic? Let's find out from Mark Henick, mental health strategist and advocate. He joins us now from Toronto, Canada. Mark, thank you so much for joining us on The Final Word.
Hi, Rico. Thanks for having me.
So, Mark, does prolonged isolation and worries about this pandemic take its toll on mental health?
It absolutely does. The coronavirus pandemic in many ways has been a trauma that people weren't expecting. They weren't prepared for this. They've had to change their entire lives and haven't had contact with the people that they love and care about for a very long time now. So initially, I think it was a shock, but now the loneliness is setting in. The isolation in every sense is being internalized, and people are having a really difficult time getting through it.
So how does one overcome this anxiety, this stress, this depression during this lockdown?
The first step always has to be to recognize it. Look, I'm a mental health professional and advocate, but I'm also a person who lives with anxiety myself. So one of the practices that I implement in my everyday life and that I recommend to others is something called RAIN, R-A-I-N. The RAIN is standing for recognize what's happening. Surprisingly few people are able to say, I'm experiencing stress right now. I'm experiencing anxiety or depression or whatever else it is. If you name it, then you can do something about it. Then the next step is to allow it to happen. Don't necessarily try to change it. Don't cling to it too tightly. Allowing it is the A. Investigate it, the I, R-A-I-N. Investigating it means asking yourself questions. What are your triggers? How do you know that you're doing unwell? But then more importantly, how do you know when you're well? What do you need to put in place? And then finally, just having this natural awareness of your surroundings, letting it be, reminding yourself that this will pass. We don't know when, but we know that this will pass.
Easier said than done, Mark, to be able to follow this key advice of RAIN, R-A-I-N. But should we be, how can we do this if we are by ourselves? Or should we be speaking to a counselor?
Absolutely. So this is where stress turns into anxiety, and those are not the same thing. Everybody experiences stress, and in many ways, stress can be good. It can motivate us to do things, to get up out of bed in the morning, to perform well. But when it starts to interfere with your day, when it starts to interfere with your life, when you find that you're shaping your life around your stress and anxiety by, for example, avoiding things or isolating, or you're constantly feeling on edge or irritable, these are signs that it might be actually turning into a clinical condition of an anxiety disorder. And that's when it's key to reach out to a healthcare professional, whether it's your family doctor or a psychologist or psychiatrist, because these are some of the most treatable mental health conditions in the world are anxiety disorders, and it's because they're so common.
But can you give us some ideas on how we can remain upbeat if we have really no one to speak to during this lockdown?
This is where it's key to be able to lean into that acceptance piece, that natural awareness piece of the RAIN acronym. We can't change this situation. We have to accept it. That doesn't mean liking it. It doesn't mean endorsing it or condoning it or wanting it to continue. It just means it is what it is. And we have to be able to find coping strategies within that uncertainty, recognizing that we can't control this. And oftentimes the stress and anxiety that we feel is from our futile attempts often to control a situation that is out of our control. So learning how to get comfortable with the discomfort, I think, is a key part of not experiencing anxiety as acutely, because we don't know when this is going to stop.
Absolutely. We are up against an unknown enemy in COVID-19. And, you know, here in the Philippines, Mark, kids below 21 are not allowed to leave their homes. They have been isolated for the past 3 months. What kind of advice can you give parents to manage their kids' stress levels?
The first thing, look, I'm a parent myself, and the first thing I need to recognize is to check in with myself to recognize when I'm having a hard day, because many parents have experienced this themselves already. When they're stressed and overwhelmed, often they take that out on their kids. They project their own stress and their own anxiety onto their kids. So I think it's important to be able to recognize when you need to take a breath, when and how you're able to help your kids connect with others outside the home that are not you. But then also recognizing too when restrictions do start to loosen up and kids do go back to school and leave the home, likewise for parents going back to work, we need to be able to recognize any symptoms that might arise later. I'm very concerned as a mental health advocate that we're facing an upcoming wave of mental health problems and illnesses as we start to go back to another big change to whatever this new normal will be. So we need to pay attention to all of these factors, I think.
Absolutely, and this could be leaving with all of us a long-term mental scar. Thank you so much for joining us on The Final Word. Mark Henick, mental health advocate, joining us from Toronto, Canada.